Now coming towards corpuscularianism, I have already shown you the diagrams in the anatomy of the medial surface of brain, where you can see them quite nicely and clearly. So, what is corpuscularianism? It is a large white matter tract that connects the two cerebral hemispheres of the brain. It is an incredibly important structure and functional part of the brain as it allows us to perceive the depth and enables the two sides of our brain to communicate. So the anterior half of the corpus callosum, it carries projected fibers from the premotor, supplementary motor, motor anterior, insular, and anterior cingulated cortical areas, while the posterior half of the corpus callosum carries fibers connecting the parietal, temporal, and the occipital lobes. You have already seen the part of the corpus callosum that includes this rostrum and this bend, which is the genu. This is the body. This is the narrowing over here that you can see the isthmus, and this is the splenium. There are a few sections given over here. You can see, have a good image in coronal image. You can see these fibers radiating like this, and then this is you can see how you can, if you just cut it like this, you can have this orientation of the fibers going from the corpus callosum. You can see they are diverging over here, and this is obviously the sagittal section that we have already looked at. So, with the corpus callosum, I really wish to tell you a few clinical correlates. This is the butterfly glioma. This picture is from a case given in the Energy in the New England Journal of Medicine. In this case, you can see there's an 83 years old woman that is presented to the emergency department with weakness, slurred speech, and urinary incontinence. This MRI shows a symmetrical bifrontal lesion that extends across the corpus callosum and it resembles a butterfly. A biopsy was performed and glioblastoma was diagnosed. You can see it quite well. It's a classical case. That's why I have included it. You can see it's going on the both sides of the corpus callosum. You can appreciate it quite well. The butterfly gliomas are high-grade astrocytomas, either mutant or glioblastomas, either wild type, that cross the midline via the corpus callosum. Other white matter tumors that are also occasionally involved. The term butterfly refers to the symmetrical wing-like extension across the midline, as you can quite well appreciate in this brain scans. In these MRI scans, you can have a very clear view of this. The butterfly gliomas most frequently occur in the frontal regions, crossing via the genu of the corpus callosum. However, posterior butterfly gliomas are also being encountered, as you can see over here in these pictures. In this picture, axial T1 weighted images showing hyperintensity. Can you see over here? Can you appreciate it? Hyperintensity of the left parietal white matter that is extending across the corpus callosum. I really want to tell you that usually, corpus callosum is quite resistant to infiltration. So if there's something that is crossing it, it means that the lesion is very aggressive. So you have to think about a high-grade gliomas. You have to think about this glioblastoma. So so these glioblastomas are the ones usually encountered in our practice that cross the corpus callosum. And axial T2 weighted MR images that showing the hyperintensity. This is, you can see, this is over here. And enhanced axial T1 images you can see over here quite nicely. So this is extending across the corpus callosum. This is the posterior part of the corpus callosum. So you have to think about it. Another important thing over here is the corpus callosotomy, which is a surgery used to treat epileptic seizures when anti-seizure medications do not help. So the procedure involves cutting a band of fibers, the corpus callosum, in the brain, and afterwards the nerves cannot send seizure signals between the brain's two halves and make seizures less severe and frequent and may stop them completely. And there is also the interhemispheric transcallosal approach, which is a versatile approach to access intraventricular tumors of the lateral and the third ventricle. So these are the pictures I have taken from the Neurosurgical Atlas, and I'm really thankful to them for all the wonderful things that they have loaded. And I really wish you to also consult it whenever you need anything to learn about. So when you see over here, You can see no difference in color between the cingulate gyrus with a small arrow over here and the corpus callosum with a large arrow. The corpus callosum is glistening white and stands out from the surrounding cortical tissue. Okay, and there's also can you appreciate these two in this diagram and over here as well. Can you very well appreciate these pericallosal vessels. These are the paired vessels. You can also see over. You can have a very good idea over here, because if you compare from here and here, you can see there are two vessels over here. Okay, these are the two vessels. These are pericallosal arteries. You have to incise midline between these paired arteries, and you can have this general view, a very nice view. So you can appreciate if you see these two. It's very because they're quite side by side, not side by side, but upside down, up and down. So you can have a very good comparison when you see and appreciate it, and when you are actually operating, then you have a very, very nice view. And you can have quite some sort of like a very striking recognition of the corpus callosum and the pericallosal arteries, although there can be other things to consider. And I think that I will be able to, design another course regarding more surgical and surgical nuances and surgical, important points surgically. So for you, just try to remember this. So posterior thalamic tumors and pineal masses with predominantly superior extension are also reasonably candidates for the posterior interhemispheric transcallosal intervenes. So you can see over here, it is also this image of the colloid cyst, where a 1.5 centimeter callosotomy has been done to provide wide visualization of the foramen of Mandro and the choroid plexus, intercerebral and the thalamostriate veins. Near navigation guides the precise location of callosotomy. If the septal pellucidum herniates into the operative field and obstructs the interventricular view, its fenestration will relieve this herniation and clear this view. So when you are considering corpus callosotomy, then you have to think about disconnection syndromes. Following corpus callosotomy, which is what I've told you, this you are just making a incision in this corpus callosum, or or you are separate or causing cutting the band of these fibers for seizures, or you can make this type of interhemispheric transcallosal approaches. So when you are considering that, following corpus callosotomy represents complex and variably expressed groupings of signs and symptoms affecting motor control, spatial orientation, vision, hearing, and language. Compared with total corpus callosotomy, acute and chronic disconnection syndromes have been found to be less and milder in patients where the corpus callosotomy surgery spares the posterior portion of the corpus callosum. Fiber tract studies using MRI have shown that posterior corpus callosum transfers the perceptual information. So it is more important if the posterior corpus callosum is being involved. So now coming towards the blood method.